Hello friends, today we will see MCQs in cardiology topic. First question, a 64-year-old male with history of hypertension presents with severe chest pain radiating to back. BP right arm 180/100, left arm 140/90, ECG normal. So here severe chest pain radiating to back is a first keyword. Second keyword, BP right arm 180/100, left arm 140/90. So BP difference from extremity to extremity, right and left variation. This is the second keyword. So third is a ECG is a normal. So third. So ECG is a normal. So this is not related to heart. It is not STEMI, aortic dissection, pulmonary embolism, pericarditis. So this keywords is related to answer is aortic dissection. BP difference between arms plus tearing pain is a aortic dissection. This is the answer. Second question, a patient with inferior wall MI develops bradycardia, hypotension, first line management. So we know that bradycardia treatment is a answer is atropine. Symptomatic bradycardia, atropine is a first drug. Next question. A young female presents with palpitation. ECG shows narrow QRS tachycardia. Heart rate is a 180 per minute. Vagal maneuvers failed. Next step. IV amiodarone, IV adenosine, IV lidocaine, IV magnesium. So here palpitations, ECG shows narrow QRS tachycardia. Heart rate is very high, 180. So this shows a SVT symptoms. They try a vagal maneuvers, but it was failed. So next drug what we used? So we use a IV adenosine is the answer. SVT we give IV adenosine. So here the SVT ECG. Sometimes they shows the ECG, then asked about drug. Here they explain the case with the words, then asked drug. Sometimes they asked with ECG. After thrombolysis for STEMI, patient develops sudden severe headache, vomiting, most likely complication. Recurrent MI, intracranial hemorrhage, cardiogenic shock, pericarditis. So after thrombolysis given, the patient severe headache and vomiting. We know that the side effect of the thrombolytic is a hemorrhage, internal hemorrhage. So answer is a B, intracranial hemorrhage. Major risk of thrombolytis is a hemorrhage. A patient presents with chest pain relieved by sitting forward. ECG shows diffuse ST elevation. Diagnosis: STEMI, pericarditis, non-STEMI, P, pulmonary embolism. The answer is a pericarditis. Here pericarditis keywords is a chest pain relieved by sitting forward. ECG, in ECG diffuse ST elevation is the keywords of the pericarditis. Okay. Next question. A patient in ICU suddenly becomes unconscious. Monitor shows chaotic irregular waves, no pulse, immediate action. So here, no pulse. So no pulse. This is a very emergency condition. So we use immediately defibrillation. Ventricular fibrillation. So this is condition is a ventricular fibrillation. So shock immediately because ventricular fibrillation is a shockable rhythm. A patient with heart failure is on furosemide. He develops muscle weakness. ECG shows U waves. Electrolyte imbalance. So in cardiac failure, we use the furosemide. So Lasix. So patient develops a muscle weakness. ECG shows also U waves. What is the electrolyte imbalance? In heart failure, loss of potassium. So here answer is hypokalemia. In loop diuretics, potassium loss happens. So in hypokalemia cases, ECG shows a U waves. In hyperkalemia, tall T waves. Hypokalemia, U waves. So please remember this. It will be very useful for your NORCET exam. Post anterior MI, patient develops new systolic murmur at apex radiating to axilla with pulmonary edema. Diagnosis. So here the keywords is post MI. So post MI, complication is one of the papillary muscle rupture. So new systolic murmur at apex radiating to axilla. This is the keyword for mitral regurgitation. So answer is papillary muscle rupture, mitral regurgitation. A patient with asthma developed chest tightness after receiving beta blocker for hypertension. Which drug likely caused it? Asthma developed chest tightness after receiving a beta blockers for hypertension. So, which drug caused? Metoprolol, propanol, enalapril, amlodipine. So, answer is propanol because propanol is a non-selective beta blocker. So, it creates a bronchospasm in asthma patients. So, metoprolol is a selective beta blocker, but propanol is a non-selective beta blocker. A 60-year-old diabetic presents with sweating with mild epigastric discomfort. ECG shows ST depression B1 B3. Troponin elevated. Diagnosis. So we know that in MI ST elevation, but here ST depression in B1 B3. So note this. We have to know that posterior wall MI is answer. In posterior wall MI, we note that ST depression in B1, B3. Okay, answer is posterior wall MI. Reciprocal changes of posterior MI. This word is very important. Reciprocal changes. A patient with acute MI receives nitroglycerin and suddenly becomes hypotensive. Lungs is clear. JVP is elevated. Most likely cause. We know that clearly because previous videos we seen that this question about right ventricular infraction. We have to note that because right ventricular infraction, we seen that hypotension, lungs is clear, JVP elevated. It is the keywords of the right ventricular infraction. Okay. Next question. A patient in atrial fibrillation, heart rate at 160, suddenly becomes hypotensive and confused. Immediately stepped. So here, patient in AF, atrial fibrillation, suddenly becomes hypotensive and confused. Immediately step, we have to give the shock, synchronized cardioversion. Post MI, day 3, patient develops fever and pleuritic chest pain. Pericardial friction rub heard. Diagnosis. So post MI, day 3, patient develops fever and pleuritic chest pain. So fever, so inflammation here. So pericardial friction rub also here. So answer diagnosis is acute pericarditis. In early post-MI, acute pericarditis, restless is a late syndrome of the after post-MI. So answer is acute pericarditis. A patient presents with severe hypertension, headache, papilledema and chest pain. Best IV drug. So this is a very emergency condition. Severe hypertension, headache, also papilledema and chest pain. So severe emergency condition. So IV drug we have to give nifedipine oral, enalapril oral, furosemide oral, but labetalol is here IV. So this is a drug we have to give the severe hypertension, IV labetalol. A patient with dilated cardiomyopathy develops sudden palpitations. ECG shows wide QRS tachycardia. Pulse present. Diagnosis most likely. A patient with dilated cardiomyopathy. So here ventricular tachycardia is a cancer because we have to see that already ECG class. ECG shows wide QRS tachycardia. It is a ventricular tachycardia VT. A patient develops torsodis d pointis. Which drug is preferred? So also we seen that in ECG class torsodis d pointis, it's seen in a hypomagnesemia condition. So we have to give the magnesium sulfate injection. Okay, answer is magnesium sulfate. This is the dorsody d pointis ECG. A patient with chronic AF not on anticoagulation develops sudden right-sided weakness. Most likely cause hemorrhagic stroke, embolic stroke, hypoglycemia. Caesar. Answer is a embolic stroke because we know that chronic AF side effect, stroke. We seen that ECG class. So we have to give the anticoagulation. That is a blood thinner we have to give Example warfarin. So if not give, because not on anticoagulation, if not give, happen stroke, right-sided weakness. This is an embolic stroke. 8. Patient in shock. BP 70/40. Warm extremities. Bounding pulse. Low SVR. Systematic vascular resistance. High CO, cardiac output. Type of shock. See, hypotension. And then warm extremities. So, this is the shock of the septic shock. We know that shock, also hypotension. All shock is present in hypotension. Then warm extremities. Okay, so this is the septic shock. Which condition shows short tooth waves in ECG? We know very well because we see that chapter in ECG also clearly. So answer is atrial flutter. See ECG like saw tooth appearance. Okay, atrial flutter. Last question. Patient develops sudden severe chest pain in radiating to back. Widen mediastinum on X-ray. Diagnosis. So radiating to back. Already first question we see that is the answer is aortic dissection. Aortic dissection, pain, chest pain radiating to back and widened mediastinum on X-ray. Also BP difference in the extremities. So this is the keywords of the aortic dissection. Aortic dissection is a very important topic in the NORCET. Okay. Thank you so much.